Okay, so we are continuing on the exercise for task 6. On this occasion, Maribel is going to start with her presentation about behavioral problems in the classroom. So you can start, Maribel.
Okay, good morning, partner and tutor. My name is Maribel Fajardo Sanchez. I live in Florencia, Caquetá. I study language English and I work in the institution Buenaima. And I English teacher and Spanish too. And start the topic. The topic is behavioral problems in the classroom. Continue. First, I am going to show the school where I work and where these behavior problems are perceived with my students. It is learns institution. The modality is the agriculture part and ornamentation. Continue. The problems is essential psychological since young people with antisocial behavior had a significantly lower hair and rate both and rest and under stressful condition. The body autonomy, nervous system control, heart rate, breathing, vision change, and more. That is why stress is good to control because it lets students commit acts. Sign stress cause wear and tear on the body, physical, emotional, and behavioral system is developed. Continue. Neuropsychological correlates. The language deficit could be the basis of the difficulties they have in understanding the consequence of their behavior and the inability to adequately supervise and control the behavior. The children with the predisposition to conduct or disorder and poor development or language skill and on lower cognitive ability are at increasing risk for antisocial behavior to adolescent and adult homes. It's important measure of the executive function on inhibition, impulsivity, cognitive flexibility, planning and organization. Continue. Intellectual and academic performance. Both academic achievement and delinquent behavior were influenced by the young effect to early behavioral problems and low IQ. The students do not respond to the stimuli or question and answer has a low level in the academic part. The other children reject them and isolate them, and this made the apathy for the student. For example, the student no colocai attention to the class. Continue. Problems with cognitive disability difficulties. They are students who present a cognitive difficulty or disability in self-esteem. In the case of people with mental disability, there may be communication, difficult signs in addition in the mental deficiency. There might be physical problems that prevent normal communication. Personally, in different grades of institution, I have found this type of disability. One, as a teacher, does not have the tools to work with children. I have had to talk for strategies and workshop. I personally consider it's important apply them and find a way to help together with the family parents. Other, distraction and addiction problem. Distraction is the most obvious symptoms, the one that alert teaching professionals. The student had distraction such as games and do not concentrate on their homework or the explanations of the classmate. But they will become addicted and get sick due to excessive use the technological tools such as the cell phone. In this class, the student is distracted by cell phone, is not paying attention to the classmate presentation. It is for the student no paying attention in the classmate. Continue. Hallucinogen problems is the loss of coordination, hallucinating, increasing blood pressure, heart rate, and body temperature. More recently, people report using these drugs of social or recreational purpose, including for fun, coping with stress, spiritual experience, or just to feel different. I had particularly had to do work with parents because them a bit presented and all spiritual with some children with problems or lack of guts. Conclusion, we should all try to do a good job and manage student behaviors. Thank you.
Thank you, Maribel. Now
Okay.
let's do our exchange of questions. Who wants to start?
Yes, I have a question for Maribel.
Okay.
Maribel, do you consider what family factors may influence in student performance?
Okay, in the school is different behavior in class. Is the drugs, is the apathy, the class, is the lazy work in class. Is important performance, different activity, call the family, explain the problems, the coordination with the titular, with the orientation, the different problems in groups, organize the performance the problems. Is considered in the teacher, organize, help the students, help the organize the problems, and carry the psychologists, the compromise in grades, process in discipline, in academics too.
Okay, thank you.
Thank you, Maribel. Erika has a question.
Yes.
Okay.
Maribel, do you think cell phones should not be accepted in the classroom?
Repeat, please. I don't listen.
Okay. Do you think cell phones should not be accepted in the classroom?
Okay. In this form, I encounter different problems. Problems, for example, the students' apathy, attend the class, in the class, only use cell phone in class, no collocate attention the teacher, no organize the words. It's important in this moment, call the attention, the help the students. I consider it's important in this moment. I personally, I am teacher, age 28. It's my experience in Spanish. I am linguistic and to English. It's different for the carry to a student is important. No, not to the student. No, in this moment is spiritual, is order the process, is call the student, speak with the student, is the form, and the student change the attitude.
Thank you. Now, Dalila.
Okay, Maribel, how do you deal with problems with your students?
Yes. In my classroom, there are different problems. Problems in the drugs, and I identify in class a student B with drugs. I make different words with a student with drugs. The problem, the student apathy by the class. In this moment, you as teacher identify the problem, the conduct behavior in this moment. When a student no work, when the student no speaking, when the student no write in the task in the notebook. I consider is important now these difficulties.
Okay. Those were 3 questions, so I won't ask any other. I will go directly to the feedback. Okay, Maribel. So about your presentation, I think it was very concise, very clear. I appreciate that you included photos of your institution. We can see how do you manage or how is your experience on the teaching approach that you took for this presentation. I must say that you provided enough research and that you consider all the dimensions for students, or maybe the reasons why students have these behavioral problems. You included the cognitive issues, the psychological, the affective issues, which maybe is a very complete view of what you wanted to show us today. And I also appreciate that you also explain in which cases do you have students with these problems. Maybe I will have wanted a little more expanded or a little bigger conclusion. I think that your conclusion was a little short. You explained a lot what were the causes for these problems, but I think it will be even better if you provided maybe some recommendations or strategies to approach these issues, okay? That was my only advice about your presentation. Regarding the questions and answer exchange, I think you started well. You did a very good performance on this side. Maybe on the last question, you were a little confused because your partner asked you, how do you deal with problems? And you mentioned the problems, but you didn't say how you deal with them. You said it is important to know, but how? How do you deal with these problems? Maybe that was a little misunderstanding with the question. That was the only thing that I found that maybe you can improve. But otherwise, you did a very good job as well. So thank you so much.
Okay.
Okay. Let's stop recording.